Hey guys, welcome to Fun Learning. In this video, we are going to discuss about the acromioclavicular joint biomechanics. With no further delay, let's get started. Acromioclavicular joint is basically an plain synovial joint. Now let us discuss about the function of acromioclavicular joint in detail. So the primary function of the acromioclavicular joint is to allow the scapula to rotate in 3 dimensions during arm movement. So whenever you do arm movement, okay, this joint allow the scapula to move in all the 3 dimensions, and this function satisfies 3 objectives. And in order to remember the 3 objectives, try to remember the mnemonic CPR. In that, C stands for contact. So this function helps to maintain or maximize the scapular contact with the thorax. P stands for positioning. This positions the glenoid beneath the humeral head. And R stands for range of motion, and this function generally increases the range of motion of the arm. Okay. Acromioclavicular articulation, as the name suggests, this joint is basically an articulation between the radial end of the clavicle and the acromion process of scapula. And you have to remember one more important point. This acromioclavicular joint, initially it is not a synovial joint. It is basically an fibrocartilaginous joint. So when we start using our upper extremity again and again, or when you start using your upper extremity over time, the joint space is created in between these two articular surface, thus converting the fibrocartilaginous union into a synovial joint. So you have to remember one important thing. Initially, this acromioclavicular joint is a fibrocartilaginous union. There is no space between the two articulating surfaces. But when you started using your upper extremity, over time, what happens? This fibrocartilaginous union is converted into a synovial joint. Okay. Now let us discuss about the capsule and ligament of the acromioclavicular joint in detail. The capsule of acromioclavicular joint is generally weak in nature. Okay, va? And when we want to discuss about the ligament, we have two important ligament here, which are nothing but the acromioclavicular ligament and the coracoclavicular ligament. First, let us discuss about the acromioclavicular ligament in detail. This acromioclavicular ligament is interdivided into superior and inferior. Okay, va? First, let us discuss about the superior acromioclavicular ligament in detail. So, this superior acromioclavicular ligament one of the very important function abdina, it is a main restraint to movement caused by anterior forces applied to the radial clavicle. So, what they are trying to say here is, consider this as a radial clavicle. Okay, va? இப்போ ஆன்டீரியரா நான் ஒரு ஃபோர்ஸ் கொடுக்கும்போது இந்த ரேட்ரல் கிளாவிக்கல்ல நடக்கக்கூடிய மூமெண்ட்டை இது ரெஸ்ட்ரிக்ட் பண்ணும் அப்படின்னு சொல்றாங்க. ஸோ வென்எவர் ஐம் அப்ளைங் த ஆன்டீரியர் ஃபோர்ஸ் டு த ரேட்ரல் கிளாவிக்கல், அதனால நடக்கக்கூடிய, ஸோ இந்த ஆன்டீரியர் ஃபோர்ஸ்னால ரேட்ரல் கிளாவிக்கல்ல நடக்கக்கூடிய அந்த மூமெண்ட்டை இந்த சுப்பீரியர் acromioclavicular ligament வந்து restrict பண்ணும். And this superior acromioclavicular ligament is reinforced by the aponeurotic fibers of trapezius and deltoid muscle. Thus, this superior acromioclavicular ligament is the strongest ligament when compared to the inferior acromioclavicular ligament. Okay, and now let us discuss about the coracoclavicular ligament, which is a very important ligament in the case of acromioclavicular joint. This coracoclavicular ligament has two parts, namely, which are nothing but the conoid part and the trapezoid part. This conoid part, it attached to the conoid tubercle, whereas this trapezoid part, it attached to a trapezoid ridge, and both is present in the inferior surface of the clavicle. Okay, va? And conoid ligament oda function enna அப்படினு சொன்னா, so So as I said, basically this joint is basically an articulation between, that is the acromioclavicular joint is basically an articulation between the acromion process and the radial end of the clavicle அப்படின்னு சொன்னேன்ல. So conoid ligament ஓட one of the very important function is nothing but this ligament restrict the inferior translation of acromion process in relative to radial clavicle. So acromion process கீழே போகாம inferior translation of the acromion process எது restrict பண்ணுமா, conoid ligament restrict பண்ணுமா. ஓகேவா? And when we come to the trapezoid ligament, this trapezoid ligament restrict the posterior translation of the radial clavicle. So conoid ligament என்ன பண்ணுது? It is restricting the inferior translation of acromion process, whereas trapezoid ligament is restricting the posterior translation of the radial clavicle. And these two ligaments, that is the conoid part and the trapezoid part, together limit the upward rotation of the scapula at the acromioclavicular joint. Okay, va? So whenever a person bear weight on an arm, so if, for example, a person falls with an outstretched arm, for example, a person falls like this அப்படின்னு வச்சுக்கோங்க. So இப்படி விழும்போது the force from the ground will go to the humerus. ஓகேவா? humerusல இருந்து it will go to the glenoid fossa of the scapula. From the scapula it will go to the clavicle via the coracoclavicular ligament, not via the acromioclavicular joint. ஓகேவா? ஸோ இப்படி விழும்போது இந்த ஃபோர்ஸ் வந்து ஃபர்ஸ்ட் எங்கே போகுது? ஹியூமரஸ்க்கு போகுது. ஐ மீன் ரேடியஸ்க்கு போகும். ரேடியஸ்லேருந்து ஹியூமரஸ்க்கு போகும். ஹியூமரஸில் இருந்து கிரினாய்டு ஃபோர்ஸ் ஆஃப் த ஸ்கேப்புலா. ஸ்கேப்புலாலேருந்து கிளாவிக்கலுக்கு எப்படி போகுது? வயா த கொரகோக்ளாவிகுலர் லிகமெண்ட். கிளாவிக்கலில் இருந்து அட் லாஸ்ட் இட் கோஸ் டு த ஸ்டெர்னோக்ளாவிகுலர் ஜாயிண்ட். ஓகே? And this coracoclavicular ligament couples posterior clavicular rotation and upward rotation of scapula during arm elevation. So arm elevate ஆகும்போது two important function நடக்கும். ஒன்று வந்து there will be posterior clavicular rotation, இன்னொன்று scapulaல upward rotation. இந்த ரெண்டு மோஷனையும் couple பண்றது during arm elevation is nothing but the coracoclavicular ligament. Now let us discuss about first let us discuss about the internal and external rotation. So in the internal and external rotation எந்த ஆக்சிஸ்ல நடக்கும் அப்படின்னு சொன்னா vertical axis. And this internal and external rotation of scapula occur basically during protraction and retraction. So when you protract, internal rotation occur. When you retract, external rotation occur. So during internal rotation, the glenoid fossa of the scapula faces anteromedially. Whereas during external rotation, the glenoid fossa of the scapula faces posterolaterally. Okay, va? And there will be approximately 20 degree to 35 degree of internal and external rotation occur, although up to 60 degree may be possible. Okay? Now let us discuss about the anterior and posterior tilting. So and second is nothing but anterior and posterior tilting, which basically occur in the oblique coronal axis. Okay va? So anterior tilting அப்படின்னு சொல்லும்போது acromion process moves forward and the inferior angle of the scapula moves backward. Okay va? posterior tilting அப்படி ஆப்போசிட்டாக நடக்கும். ஸோ anterior tilt ஆகுது, posterior tilt ஆகுது. ஓகேவா? ஸோ இந்த மூமெண்ட் எப்போ நடக்கும் அப்படின்னு சொன்னால் when the scapula moves upward or downward on the rib cage in elevation or depression. Tilting occurs to maximize the contact between the scapula and the curvature of ribs. Okay? The magnitude of anterior or posterior tilting during in vivo arm elevation is 20 degree, although up to 40 degree or more may be possible. So range of motion is nothing but 40 degree, இல்லை அதுக்கு மேலே கூட possible அப்படின்னு சொல்கிறாங்க. And the last is nothing but upward and downward rotation, which occur at the oblique anteroposterior axis. Okay, so upward rotation அப்படின்னு சொன்னா glenoid fossa will move upward and your inferior angle will move laterally. So upward rotation இதானே. ஸோ glenoid fossa இது glenoid fossa வச்சுக்கோங்க மேலே போகுது, அண்ட் இது வந்து inferior angle வச்சுக்கோங்க இது லேட்ரலாக போகுது. ஓகேவா? And 30 degree of upward rotation and 17 degree of downward rotation is possible. Okay, so, and this acromioclavicular joint is not very stable in nature when compared to the sternoclavicular joint, thus making it susceptible to many kind of injuries and traumas. So, especially this acromioclavicular joint injury occur in the case of contact sports or fall on the shoulder with arm adducted. Okay. With this, I'm completing today's video. Thanks for watching. If you like this video, please subscribe to my channel. Stay home, stay safe.